Hello, it's Rafael Gutierrez, and today I'm going to talk a little bit more about the Bubishi. It seems like some of you are actually enjoying these and subscribing. If you are enjoying them, subscribing, thank you. If you're not enjoying them and subscribing, well, I guess something's off there. But I I hope you're well. I don't mind if you don't. If you don't not enjoying it, and you still want to subscribe. I'm all okay with that. Uh, but I will talk about the Bubishi, and I will show you some of the pictures. Now, before I even go on, one of the things you'll notice is that there are a lot of points which actually in the head, which are actually told um, as serious points that for striking that can cause a lot of damage. One of the things that you may also notice is that if you hit someone in the head just by mere accident, you may end up hitting some of these points. And I should mention, if you really are interested in knowing how dangerous getting hit in the head is, I would actually tell you to either pick up this video, One Punch Homicide, or you can go to their website, onepunchhomicide.com, and you can watch it there. They think they charge you $1 or something like that. Great video because you'll actually, especially if you're teaching any sort of martial art where someone may get hit in the head, so you can understand, and you can tell your kids, your students, look, any hit to the head is dangerous. It doesn't matter how soft you think it is. Most of the people who were interviewed were in jail, and one of the things they all said is, I didn't know it was so easy for someone to die from a blow to the head. And you actually will see how people are affected by the whole having to live with taking someone's life. Now, one of the things I also wanted to say is there's a lot of different versions of the Bubishi. There's a lot of different strike points, and there's a lot of different people who tell you, oh, this works and this doesn't. I will only go through the anatomy. I cannot tell you, okay, based on I don't know, chakras, this works. Cannot say based on Chinese medicine this works. I cannot talk about Chinese medicine because I do not have a doctorate in Chinese medicine. I do have an MD, and I teach anatomy, so that's what I'm basing the information I give you on. Now, I do believe that if anyone who gives you any information on Chinese medicine who doesn't have a doctorate is doing a disservice to both you and Chinese medicine, because Chinese medicine is something that you do need to go and study with someone who actually knows what they're doing. It's a lot of the things you can't. For instance, I will tell you anatomy. You can't pick up a book and find out what they're talking about, but Chinese medicine is a little different. You actually do need to know what books they are actually looking at. Now, the couple of the points that I've already talked about, there's actually variations of. Now, some people tell you to go for the eyes. Some people tell you to go to this area here, which is called the zygomatic bone and the maxilla here. So it's a zygomatico-maxillary complex. If you remember, I did do a video on that earlier. If you would like to go, you can actually see that. Now, that area, if we look at the skull here, is this bone here. Now, you'll notice that there's little lines here, and there's actually one little line here you can almost see, and a line here. If this area here gets hit, I should mention that, and again, you can see this on the video, there's an area here which is actually hollow, thin bone. So a hit here can actually break the entire zygomatic bone off, which can end up even damaging the eye. Now, when I made the video, someone asked how long they could return to boxing after they've had that fracture, meaning that they broke it boxing, probably, I think they said sparring, and they want to know when to return. Now, what I said is you have to consult your doctor for that. Big thing is if I were practicing medicine, I don't practice, by the way, and someone came in with and asked me when they can return, I would say don't. There's too much problems that can be due to that. Now, the other place I also did a video on, it's actually here, right between the eyes, just a little above, or here. There's actually two different ones. Now, these two both are in an area where you have what they call the frontal sinus. And the frontal sinus has, again, a thin bone and a hollow cavity. Now, today, with modern medicine, we can go and we can do surgery to repair it. But without it, you have a lot to worry about. First, you have the disfiguration, and it will end up causing a lot of problems with the brain if you survive. Second, we don't know what's happening inside the brain. That break could end up leading to ruptures of blood vessels throughout the brain, can end up changing personality. And so, yes, collapsing that bone can end up leading to lifelong disabilities, and can end up leading to also, well, besides that, can also end up leading to some infections, making it easier for things to get into even your brain. The other 2 points that I'm going to talk about, like I said, today I'm going to talk about 4, is behind the ear. If you feel behind the ear, you have a big lump of bone called the mastoid process. Again, if you look at the picture here, this big lump of bone is the mastoid process. Now, I'm going to talk about 4 because 2 are almost in the same place. The mastoid process is here. The ear, external acoustic meatus, is here. Now, ear canal pretty much. So these 2 are really right next to each other. And what you're seeing is a lot of these points, you probably would, if you're actually watching all the Bubishi points, you'll notice that a lot of these points can potentially be hit pretty, they're so close that yes, they could be hit at random when you're not even trying to hit a certain place, which actually makes the whole idea of head trauma be something that's really more important. If you do believe in clinical anatomy, or if you do believe in the Bubishi, you know that by random chance, people can hit these points, and it could be life-threatening. Now, what happens if the mastoid bone gets hit? The mastoid bone, while it feels like a big lump of bone, it actually has a lot of hollow cavities in it. In that case, they're called air cells. And if the air cells get broken, it destabilizes the muscles that actually help hold the head together, help you rotate, and so it's going to cause a lot of problems. Besides that, if you break that, it tends to a lot of times affect the ear, so you're going to end up having permanent hearing loss a lot of times. You also can end up opening a cavity between the outside ear and the brain, which could end up potentially leading to meningitis. Meningitis is a bacterial infection or a viral infection of the brain. You're actually worse off with the bacterial infection than the viral one, which if anyone's interested, I could tell you about that. And that is problematic. The other thing is the ear. Now, hitting the ear directly can cause the permanent hearing loss as well, but it also can rip the eardrum and cause cerebral spinal fluid to leak out. Well, actually, technically, both of these can. If you do have cerebral spinal fluid leaking out of your ear, either because the mastoid process of the temporal bone broke, or the ear canal broke in a certain way which allowed cerebral spinal fluid to come out, it is also something that can be life-threatening. The reason is, once you've actually broken it, the brain usually is protected from everything. I mean, it doesn't even touch blood directly. And when you get trauma like that, it can tear the meninges, the outer coating to protection. And when that breaks, bacteria can go in. And so either way, you have an increased risk of infection and potentially death later on. Now, one of the things I actually have said before is I honestly believe that a lot of the Bubishi, while it could be done with a strong enough fist, probably was more done as a way to tell people, look, be careful with these injuries. Not as much to cause the injuries, but you see someone who got hit by a head with the 2x4, for instance. If you see that they were hit somewhere else, you may need to take them to a doctor right away. If you're training with bow and you do something and you accidentally hit, chances are these points were actually meant to let people know this is not a place that you want to wait around. Take them to some sort of doctor. And one of the things I'm actually seeing as I go more and more into these is, yes, these are actually places that could potentially kill someone. It could cause delayed death because of either infections or abnormal bleeding that we can't see, internal bleeding that you can't see. And it may be that many of these legends that we've actually read about or heard about, someone getting hit and dying a week later, may actually be correct. Now, with all that said, I will sign off. I hope you enjoy this. I know it's short. If you enjoyed this, please subscribe. If you have any questions, any at all, please put them on the comment. I will answer them, or email me, and I'll answer questions via email too. And one of the things that every martial artist should do is take your training serious. Look outside of what you feel comfortable in, and don't think you know everything. I will tell people, I can tell you the clinical anatomy, I can tell you the physiology, I can tell you what I know. But if someone's telling me, if a doctor in Chinese medicine is telling me based on Chinese medicine, this does X, Y, Z, I have to take his word for it because I am not a specialist in that. I will say I know my limitations. I know that, yes, I can do these basic science classes, but there's people who know more than I do. If a ears, nose, throat surgeon pretty much tells you this point here is actually worse because of whatever, I would take his word for it because he actually works in those areas. Uh, I actually also, you will notice that I will not talk about business, how to run a business. The reason is, uh, well, I do have a dojo. I don't do it for money. I do it more for a hobby. Try to make sure my students actually know as much as I can. I can teach them. If you want to run a school, there's people who know how to run schools, and they'll tell you. Actually, there's some people who I have a lot of respect for who have big schools, and they teach in a way that it works. Uh, and so the big thing is, when you are looking at all these things, look at them seriously. Don't take my word for it necessarily, but go into your different anatomy books. Actually, I have one here. You'll always notice that I have books everywhere if you ever come meet me in San Diego. And you do have to look at books. You have to look at the internet. You have to look at PubMed, and that's the only real way you can end up saying what works and what doesn't. Uh, so I hope you enjoyed this video, and if you did and you want to help support, there's actually a couple books, Serious and the Rarest Things, Off the Rails, My Breaking Point. Those will help me have more time to do my channel. I hope you enjoy this and have a nice day.